Hi, my name is Jen. I'm a shoulder and upper limb surgeon at Wakefield Orthopaedic Clinic. Today we're talking about shoulder replacements as it's becoming more popular as the technology is evolving as a good option to give elderly patients some restored function and pain relief with sore and stiff shoulders. Everyone is familiar with hip and knee replacements. That has a long history behind it, sort of half a century plus. Shoulder replacements are relatively new in the sphere of that. It's more like 20 to 30 years. And over that time, lots of different iterations and variations have arisen. I think we're getting to a point where we're getting reliably good outcomes with the latest iterations. So it's certainly something that not a lot of people know about or talk about. And I often get patients come seeing me not knowing that they can even have a shoulder replacement. Similar to knee and hip replacements, it's for predominantly arthritis, sometimes the rotator cuff arthropathy, so painful or non-functioning shoulders in the more elderly type population. Should you consider surgery for your shoulder, such as a shoulder replacement? I think the time to consider surgery is when your lifestyle is affected, so you're in severe pain, you're having difficulty sleeping at night, you're struggling to do the things that you love to do without being in severe pain. That might be the time to just start discussing things with your general practitioner or your surgeon to explore the next path. What is the operation and what is the recovery like? The operation itself should take the surgeon and their team about 1.5 to 2 hours. It's usually done under general anaesthetic with a block, a nerve block. There's an incision, or the scar is at the front of the shoulder, and the shoulder is replaced or resurfaced with metallic components and usually a polyethylene or a plastic bearing surface. The recovery, usually 2 days in hospital, as opposed to hips and knees, which are a bit longer because of the requirement to weight bear or walk on those joints. You usually will be sent home with some pain relief. Physiotherapy should be involved in your care. They're usually seen in hospital by the physiotherapists, and everyone has different protocols, but for me, the physiotherapist will start seeing at 2 weeks and start some gentle range of motion exercises. Sling is on for 4 to 6 weeks, depending on progress, and usually my patients are feeling pretty normal at around about 3 months. If you think you might be suffering from one of these conditions, or you would like more information, please go see your GP or a relevant specialist.